Welcome to the Joe Cohen Show. Join me as I share my experience with biohacking and invite top health experts to explore the latest technology, supplements, research, and resources for optimizing your body and brain. Hey everyone, I'm very excited to be interviewing Dr. Andrew On today. He is an internal medicine physician with background in physics and engineering and physiological signal analysis. He's the chief medical officer at LabFront and an assistant professor in medicine radiology at Harvard Medical School. He was a co-director for the Center of Dynamical Biomarkers and the medical lead on the X Prize winning Dynamical Biomarkers Group team. Dr. On is passionate about democratizing health sciences and exploring health from a cross-disciplinary perspective. His research includes mathematical computation analysis of physiological data and a systems approach to medicine. And he's big in some complementary and alternative medical areas such as acupuncture. So we're going to be talking about biomarkers, acupuncture, and other exciting topics on this podcast. Thanks for coming on.
Thanks, Joe, for having me.
Awesome. So let's get started with what are the most important biomarkers that you track?
Oh, probably the marker that I probably follow most is heart rate variability. Yeah. And heart rate variability comes in different sizes and shapes, as you probably know. Heart rate variability, there's at least 35 different measures, and you could usually categorize them into probably three big chunks. There's the time domain measures. That's something that most of us, or at least most of the devices that are out there, uses time domain, such as ARM SSD, or if
Okay.
you have an Apple Watch, it's SDNN. And then there's the frequency domain, where you break it up into frequencies, the high frequency, low frequency, very low frequency, etc. And then there's some nonlinear time series analysis of heart rate variability. Examples of that is DFA, which is detrended fluctuation analysis. MSC is another one, multi-scale entropy. Just a lot of terms out there, but in terms of the big categories of HRV, I would put it into those three buckets. And then what I personally follow is just what's out there normally in a lot of the wearables is the RMSSD, the root mean square of the successive differences.
Okay.
Yeah.
And just for a reference, what is your HRV?
Oh, actually, I don't know. So it really depends on what device you use. If you're doing the ARM SSD, mine is probably on average, I don't know, 35, 40. It's not great. When it comes to HRB, a lot of it has to do with sleeping well, exercising regularly, and sometimes with my schedule, it's all over the place.
Welcome to the club, the human
Yeah.
race. It's always difficult, I feel like, to implement things. That's
Yeah.
really where things get rough. That's why, to be honest, I find lifestyle stuff is a little harder for me to implement, so I just include a lot of supplements in my regimen, and I measure it to make sure that I'm going in the right direction. Yeah, I take 160 supplements a day.
Holy smokes. But what do you measure? Is HRV or anything like that sort of part of your,
Absolutely, yes, absolutely, definitely.
okay.
I definitely do measure HRV. My HRV is typically about 100, the RMSSD.
Oh, okay.
Yeah,
Oh,
and I haven't found supplements changing that too much. It does change it, but honestly, there's just I find there's things that worsen it. There's not that many things that change it in the long term. There's things that change it in the short term for me, but then long term, it just goes back to baseline, I feel like. I find that exercising more worsens it. So the less I exercise, the better my HRV is.
oh, interesting.
Yeah, I don't know. Because I guess the less as in if I exercise lightly, maybe 3 times a week, 1 to twice, go for a jog, 1 time go to the gym, and then go for walks and do a very average kind of exercise regimen, I find that's ideal for my HRV.
Hmm.
But once I start trying to follow some of these exercise gurus like Peter Attia, where he's just you need to get in your you gotta do you gotta work out every part of your body in strength training. You gotta do your VO2 max, your zone 2, your this, they're that, flexibility, mobility. Before I know it, I'm exercising 20 hours a week minimum, and my HRV just tanks. right? Like, it
Yeah.
doesn't tank, but it goes down to 80 instead of 100.
Yeah. And I think a lot of it is that it's really important what you do outside of that exercise time period. If you're stressful, your sympathetic drive is constantly in active mode. And the exercise period is obviously you're activating your sympathetic nervous system, but you need an opportunity to recover. But if your lifestyle is such that you have a stressful job, you're not sleeping well, it probably, if anything, adds to the constant activation of the sympathetic nervous system, and that may be the reason why your heart rate variability doesn't, improve with exercise. I'd love to hear what supplements you're using to keep your HRV so high.
I find most of the time it's not most of the time people with high HRVs, I feel like it's mostly genetic. Like,
Yeah.
it's not things that you could people with these high HRVs, and it's just something they've always had.
Hmm.
That's in my experience, and the people with low HRVs, I do think you can change it a fair bit, but you're not gonna go from 20 to 100. I've never seen that, right?
Yeah. No, I don't see that often. Yeah, it's really hard for me to say what are the contributing factors in terms of even the genetics, because the literature I think is all over the place. It could go down to as low as 15% of your contributing factor to 50 to 60 to 70%. It's one of those things. And also it's so variable. There's so much day to day, even hour changes that you get with it. And also age plays a factor. Gender plays a factor as well, as your heart rate variability goes down as you age as well. So it's really hard to study this in terms of giving a formula and saying, what are the contributing factors? Because it's so dynamic.
Yeah, is the Oura Ring a good way to track HRV?
I actually don't know much about the Aura Rings calculation. So as you probably know, a lot of these wearable devices have their own proprietary formula.
Mhm.
And I don't know exactly what goes into their calculations. Like Aura, I presume is just like most of the other devices, they're using RMSSD. The good thing with these ring watches is that because of the location on the finger, you tend to have more, like the density of the capillaries are higher in the fingers, particularly on the palm part of like the front of your fingers. And that you'll probably get a cleaner PPG signal, than you would on a wristwatch. But that's the only thing I could say about that. So when I'm talking about into RMSSD, I don't know, like for instance, Morpheus, I don't know, I don't actually use Morpheus, but I think what they do is they take a log transform of RMSSD and then they apply a multiplier so that there's a standard of like up to 100 or something like that. Aura may have their own formula as well. So it's hard for me and I don't use an Aura ring, so I don't know exactly
Mm.
what they use.
Yeah, based on what I've heard, it seems like it's pretty good, but I
Yeah.
do see a lot of people with the Aura that have 20 and 15
Okay.
even. So it's not like 90 is just but I will see people with the Aura who have 150. It's very rare, but does that mean that these people are even healthier, or there's a certain cutoff by which if you go higher, it's not better?
So one of the things that can contribute to high heart rate variability is if you actually have a condition has an erratic heart rate. If you
Mm,
have atrial fibrillation, for instance, then your heart rate variability, your RMSSD could go pretty high. And that may actually be an indication of a bad state of things rather than healthy state of things. So if it's really high, then you have to ask the question whether if it's actually an indication of good health or not. Because the heart rate variability is only useful if you're actually tracking the normal sinus rhythm. Like the SA node, the sinoatrial node is a pacemaker, I should say, of the heart. And it gets input from both the parasympathetic and the sympathetic nervous system. And so when you are studying your heart rate and heart rate variability, you're assuming that it's the SA node that's driving the heart in terms of the beats to beat intervals. However, if you have ectopic sites, if you have areas in your atrium or even in the ventricle that's like occasionally putting out signals and then running the heart in terms of the heart rate, then it could cause some elevated heart rhythm like HRV. And that's not necessarily healthy.
got it. So it could be the outliers. There's some problems there. It's not necessarily healthy.
Yeah, exactly.
And what do we see in terms of overall all-cause mortality for HRV, what numbers would we see as the lowest all-cause mortality?
A lot of these studies were done in the 1980s when they actually assessed. That was at a time when Holter technology, which is a way to record, was just good enough so that a person could potentially measure it and send it home. But a lot of these studies were actually done at spot intervals. Basically, the patient would come in at a particular time of day. They try to control for variables, make sure you're fasting, you're not drinking coffee, you're relatively well hydrated, you're in a you're in a seated or supine position. They try to keep it conditioned to control, but it was a spot assessment. So a person would come in for one day and they use that data then to then figure out if that's a prediction for all cause mortality or cardiovascular mortality in the long run. And I don't know the exact values, but clearly at that time, lower heart rate variability was associated with higher all cause mortality and cardiovascular mortality. And I think the heart rate variability, a lot of it, what they used was SDNN, standard deviation of NN or intervals. So N actually means a normal rhythm as opposed to RR is just any type of heartbeat. It doesn't matter if it comes from the SA node or even if it's an ectopic beat. So the SDNN makes sure that you're dealing with a normal sinus rhythm, which is what sort of gives you information about the balance between the sympathetic and parasympathetic system. And so what they did at that time was they used SDNN and then looked like one day or even one morning. And then they followed up a year or 2 years after and saw that, yeah, there was a correlation, which is amazing to me, given that since there's so much variability from day to day, that one spot assessment could actually predict for mortality.
Interesting. And besides certain things that I know are very significant for my HRV, like alcohol,
Yeah.
sleep, stress,
Yes.
how much I exercise, and how much I activate my nervous system as in general, I think. So if I like, even if it's not exercise, if I like go to the sauna, do a cold plunge, exercise, and just super active in the day, my HRV is going to go down just because it's too much. That's
Yeah.
kind of the only things that were like super clear to me. Then there's things that kind of help a little bit, but it's hard to say long term. It's not so drastic like alcohol. I drink alcohol, it goes down like 20 points.
Yeah. Yeah. Yeah.
It's just very clear. It's
It's
okay. This
very
is
clear.
super clear. Yeah.
Yeah, it's amazing. And for me, probably it's worth just because I've got that Asian flush occasionally. So my heart rate variability goes down significantly. I don't
Right.
respond well to alcohol. Yeah.
Exactly. So besides those things, just general stress reduction, things like that, what else is capable of moving heart rate variability quite significantly?
Yeah. Sleep is important. Your state of mind, obviously, if you're stressed, that's really important. When I get sick with an upper respiratory infection, it's dramatic how much my heart rate variability goes down. And it actually does a pretty good job of telling me when my body is close to recovery. Like just a month or two ago, I had a upper respiratory infection, probably viral, that lasted about a few weeks. But in the middle of the third or fourth day, I was like, okay, I think I'm going to recover. But my heart rate variability was not showing that. It was showing that it was continuously at a decreased level. And then I said, okay, maybe I need to rest a little bit more. And then, so it does a pretty good job of even predicting before consciously I'm aware of the fact that I'm getting better or even getting sick. It's a harbinger of things. So I think that's where it's really been helpful. So viral things. The other thing that seems to help, I don't know if you've heard of heart rate variability biofeedback.
General, yeah.
It's kind of feedback. What you want to do is, so as it turns out, a lot of the heart rate variability that you see on these devices, it's reflecting what's called respiratory sinus arrhythmia. So as you breathe in, your heart rate goes up. As you breathe out, like your heart rate goes down. And what it is that your parasympathetic system is either being turned off or on with each breath. If you take a breath in, the parasympathetic is inhibited, and then as you breathe out, the parasympathetic sort of reenacts or it acts to lower your heart rate. And that is what a lot of the heart rate variability is measuring. So it's a marker of your parasympathetic nervous system. And What they found out also is that in order to maximize that respiratory sinus arrhythmia, the changes in heart rate with each breath, it changes with your rate of respiration as well. So if you breathe really slowly and probably a breath every 10 seconds, then you reach what's called this resonance frequency. Basically, your breathing, your heart rate, and your blood pressure all sort of act in synchronization. And as a result of that, your heart rate or your heart rate variability gets maximized when you breathe every 10 seconds. And when you do that consistently, you're almost training your body to operate in a way so that your baroreflex is that blood pressure sensor to determine what your blood pressure is. It's much more sensitive or becomes more sensitive. And so what you can do if you do this exercise is that over time, your heart rate variability can increase.
I
It's
I think I
Yeah.
used a device like that actually from I forgot what it was called, from the Heart Math Institute.
Yes, yes,
Yeah.
exactly.
Do you wanna take a deeper in-breath and then slowly breathe out? Is that what the idea is, so that extends the time of your breathing?
And actually, according to their model for heart math, I think it really didn't matter. I think it was just maybe 5 breaths in, 5 breaths out. There are different types of breathing that's out there. There's the box breathing. You take a breath in, you hold it, and then you breathe out and then hold it. But it depends on who you ask. Some believe that if you prolong your expiration or exhalation, you're activating the parasympathetic longer. But I'm not really sure whether there's actually a difference in terms of outcome measures. Yeah, that's one of the things I'd be really interested in seeing, what the data shows.
Okay, so what is the most, studied type of breathing that improves heart rate variability?
Oh, it's a very simple in and out. Take a breath in, and then ideally you want to breathe through your nose in. And then usually you want to do diaphragmatic breathing. So you're not using a lot of your, external costal muscles. You're not using your rib muscles. You're actually trying to use the diaphragm primarily. So when you're
So in
breathing,
simple speak, it would be like breathing in from the stomach.
yeah, what
Okay.
happens is that as your diaphragm comes down when you breathe in, you're primarily depending on the diaphragm, your abdomen starts to come out. So yeah, so you take a deep breath in, but you do it slowly through the nose for about 5 seconds, using mostly diaphragm, and then out and for 5 seconds. Or-
So that's pretty simple breath. Breathe in for 5 seconds, breathe out for 5 seconds.
Yeah,
My question is, if you're when you're breathing out, you touched on this before, you increase your heart rate variability, your parasympathetic nervous system. Why wouldn't it
kicks
be
in.
that yeah, why wouldn't it be that you wanna breathe in as quickly as possible and then breathe out slowly?
Yeah, I think that's a feasible option. It's one of those things that, you want to assess your heart rate and heart rate variability and see how that affects you in the long run. I think the one that clearly affects because the what's contributing to heart rate variability is obviously not the parasympathetic, and it's the parasympathetic sympathetic, more the parasympathetic when you're talking about the shorter time frequency heart rate variability, but it's also the baroreflex, it's the pressure sensor, and in your carotid artery. And so what it is that you want to give it time for it to train itself to respond to changes in the blood pressure. So if you take a dramatic inhale like that, I don't know what that effect will have on the blood pressure or how quickly the baroreflex will respond to that. So I don't know. That's one of the things. That's why we created LabRun, is just to be able to actually get that data. You just using a wearable device and do a different types of breathing exercise and see how that sort of changes your heart rate variability in the long run, short term and long run.
Okay, is there anything else that noticeably increases heart rate variability that we didn't discuss?
There's some there's some belief that if you're exposing yourself to certain hypoxic environments, like I think they've done this in some of the special forces, where you're almost like stressing your body for a little bit, forcing it to adapt, that then after a while, your body is then increases heart rate variability. There seems to be a nice medium. Obviously, if you are just living a stress-free life, purely a stress-free life, then your heart rate variability will be good, but it's not going to increase necessarily. Your heart rate variability may be a marker of your ability to adapt. If you expose yourself to stressful conditions, and maybe that's why a cold plunge is useful, or being in hypoxic environments, or doing something that actually temporarily forces your system to go to certain extremes, then I think that enables your body to be trained to be adaptive, and your heart rate variability is a reflection of that.
So that would be similar to Wim Hof breathing. Let's say the box breathing. You breathe in, breathe out, and that creates a type of hypoxic environment in the short
Yeah,
term. Like
yeah.
that box breathing?
No, I think that's different.
Okay.
Yeah.
I'm not sure what box breathing is, but I
Box breathing, I think, is you breathe in, and then if you can imagine your inhaling, you hold it, and then you're exhaling, you hold it. So it almost looks like a box. I don't know. That's my
oh,
understanding of it.
okay.
I'm not a breathing expert, so that's the thing.
Okay.
There are probably so many other types of. There's something called ujjayi breathing in yoga, where you're trying to create the sound in the trachea. That also apparently has some benefits. I'm not an expert in this, and I would love to learn more.
Yeah, interesting. So, yeah, I think one of the things you mentioned is also quite important that I've noticed as well is the infections, inflammation, chronic inflammation from any cause, really. It's either toxin, just anything, right? Usually it's going to be an infection, but I've also found that dramatically, it could cut it in half pretty much.
Oh, easily. Yeah.
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 So I'm looking at my genetic report on self decode just to see what my predisposition for heart rate variability is. It says I'm predisposed to a higher HRV.
Oh, no way.
Yeah, and let's see, it's looking at 1,286 genetic variants, so it's a polygenic risk score. And it says here, based on the studies we found, up to 60% of differences in people's HRV may be due to genetics. So it does seem to be quite heavily genetic.
Yeah. I'm curious to see what are the components in your genetic study is contributing to HRV.
When
What
you
are
say components, what do you
like,
mean?
what are you assessing SNPs, or what
Yeah.
exactly are, yeah.
Mhm.
And I'm just curious, what genetic expression? Is it a specific receptor? Is it, what is it?
Oh,
Yeah.
these polygenic
Or,
risk scores, they look at many variants. The advanced ones that we have, they look at many variants. So there's no specific one, but there are specific genetic variants that we have here that you could see. There's a bunch of them that relate to HRV. But in general, when you're looking at many genetic variants, it like just looks at the whole picture together, right? It's hard to isolate a single genetic variant, but we do have certain genetic variants that you could look at that play a role. Those are on the report. And you could see for me specifically which ones lower it and whatnot, but that's more of an advanced feature.
oh, interesting.
And then I
Yeah.
see we have 52 recommendations.
I'm curious
I'm
to see
curious
what,
what you think of them.
yeah.
Yeah. So let's see. So these are the lifestyle ones:
Where
strength
do you,
training, avoid air pollution,
yeah.
biofeedback, mindfulness, nerve stimulation, alternate nostril breathing, yoga nidra, diaphragmatic breathing, Bikram yoga, deep breathing, cold water immersion, hot yoga. And we could click on any of these to see the references, by the way.
Yeah. How do you get these things? That you pouring through literature, or just
Yeah,
curious to see
yeah.
how you get the results
Mhm.
from that?
Yeah, we could click on any of these. Let's say air pollution. It
Oh, yeah.
says air pollution may decrease HRV by altering the activity of autonomic nervous system. Of the autonomic nervous system, the longer the exposure, the more HRV may decrease. Studied air pollutants include particulate matter, ozone, polycyclic aromatic, carbon monoxide, carbon disulfide, diesel exhaust, and these are the references. So if we just click on like a random reference, this is a
No.
systematic review and a net meta-analysis. Yeah, our study indicates that short-term exposure to ambient pollution is associated with decreased HRV, predominantly as an immediate response within hours. We've got all the research here. And in my case, I actually have a genetic variant that exposure to air pollution may decrease HRV more in people with my interleukin 6 gene variant. So this is why the recommendation comes up higher.
Wow, this is pretty impressive.
Yeah, and so altogether there's 52 recommendations, but you could let's see the supplement ones. I love the supplement ones. Is there
That's
anything that let's say omega-3, I'm just curious, that seems to increase heart rate variability, and I've noticed that when I take omega-3. I'm curious, for example, do you take omega-3 fish oil, and if not, why?
I do and do not. I am terrible when it comes to consistency taking supplements. And actually, I must admit, I don't take any supplement right now. And I should be taking omega-3 fatty acids, obviously, for the heart risks. And I presume it helps heart rate variability because it balances the inflammatory pathways. And so that's probably, if you have less inflammation, then that's probably how your heart rate variability is improved. But yeah, no, I don't have a good reason. Again, I'm just saying I should probably practice what I preach, and I don't do that.
Okay. Alright, no, that's fine. I just thought sometimes people don't take supplements and they have a reason why they don't want to, or maybe they don't like taking pills or they don't I don't know. You know
Yeah,
what I'm
I don't
saying?
personally. I don't like taking too many pills, which is an already given that I'm a physician that often prescribes pills. Uh,
Okay.
I just don't like taking it. I don't know. I just also try to do my best to modify other things, eat well, healthy. Even that, I'm not that great at. And
Okay.
there's a part of me also that if it becomes a chore or if it becomes something that I have to do, then in the end, it doesn't work for my personal disposition. That's just I'm one who doesn't like to get fixed into certain schedules and stuff. So that's just probably just more a reflection of who I am than what I believe is right.
That's super interesting because I would think that your job is you've been in through a lot of schooling, right? And medical school, or are you an MD?
Yes.
So that's a lot of schooling, right? You're in
Yes.
academia and you're constantly I guess in school you could change your schedule, but it's very regimented. You need to learn this, right? You have a
Yes.
test on this, you need to learn this. I'm the type of person where I like being regimented in certain ways in my life, but not in what I need to learn. I'm just like, I want to learn whatever I want. I don't know.
Well,
Yeah.
yeah, and I'm like that as well, but I'm also like that in my life as well. Unfortunately, I think what like medical school residency, it is extremely regimented when it comes to what you're learning, and also even the things that you have to. There's all these protocols, there's algorithms. It's extremely algorithmic. And that's the part that I didn't enjoy about medicine, to be honest. And when it came to, and this is why I do what I did, I was very interested of figuring out what's out there that we haven't studied yet. This is why I was interested in acupuncture. I was much more interested in the systems approach as opposed to a reductionist approach to the health. Like everything in medicine, in modern medicine, it's about breaking things down to the pieces. And that's why you have a lot of specialization. You have neurologists that go to, I don't know, it could be neurodegeneration. It could be focused on one specific disease. And I was not interested in doing that. I was interested in stepping back and saying, what is the bigger picture? What are there some other ways to assess this? And yeah, I'm probably not the prototypical doctor out there.
You're an MD. I'm curious, and you don't take any supplements yourself. When somebody like
Yeah.
me tells you I take 160 supplements a day, what are you thinking? What's going through your mind?
What I'm thinking is first, I'm surprised that you're able to do this, and kudos to you to have the discipline to take that many supplements is amazing.
Okay.
And I think it's just each person has their own individual preferences, and I think that's amazing that you're taking that many supplements. I think I should probably take some supplements to keep myself in a better balance. To me, the factor is: are there any interactions that are happening between these supplements? Is there something that because I see some cases where you take too much of one thing, and is there a danger? Like for instance, a lot of fat vitamins, fat soluble vitamins. If you take too much of that, it could be dangerous, like vitamin A or vitamin D, you can't really overdose too much on that, but, or even vitamin E, those kinds of things that's what I think about. But overall, I have to give you a lot of credit for doing that.
Just to give you a background, I also measure 300 blood markers, biomarkers every month. So I
Amazing.
could see how each of these biomarkers are changing. So just to
Yeah.
give you one example, my LDL cholesterol used to be 250, right?
Wow.
And now with my interventions, it's around 50. So that's a pretty steep decline in LDL cholesterol. And so that also does include the 160 includes certain pharmaceuticals. I take about 11 pharmaceuticals. One of them is
Wow.
Repatha, so a PCSK9 inhibitor.
Mm.
But I also, let's say without Repatha, my LDL-C went down to 86. So that's still quite significant with Repatha. And but one of the reasons, let's say I take Repatha, is because it's one of the few things that decrease lipoprotein A, which I have genetic higher levels of lipoprotein A. So everything I do, I measure in either subjectively or objectively, and usually both. And so I will see, for example, all these 300 biomarkers, my HRV, my recovery, my brain function, my mood, all these kinds of variables, my sleep. And I could see if I'm going in the right or wrong direction, right? With these 300 variables, especially with software, what we do is we look at all the all-cause mortality data for all of these markers, whether
Yeah.
it's liver enzymes or whatever, and homocysteine. And the problem is if I don't take supplements, my markers get worse. So I need to take a lot of supplements for homocysteine or else it goes to 20, right? And
Yeah.
now it's at 8. So same with HRV is I won't recover from exercise. If I do especially a little more intense exercise, I won't recover with my HRV. It would drop down quite so in the past I just wasn't able to exercise significantly at all because my HRV, my recovery would be too poor. And so I look at these kinds of factors. Now I could exercise 3 hours a day and still my HRV will still be in the 90s. Whereas before, just I would just get injured, my recovery, I would get sick, my sleep would suck. So I look at sleep, I look at all these mood, I look at so many variables here, and I use
Yeah.
the self decode software to help me. But the idea is that I take a very data driven and systematic, like a systemic biological approach, right? Like you're in
Hmm.
favor of, and it's very novel because nobody has taken 160 supplements a day, and especially this combination, right? But I look at these variables and I don't see anything getting worse.
Yeah.
You see what I'm
Yeah.
saying?
Yeah. No, I totally see what you're saying. Medicine is, how do I put this? Medicine is risk averse in general. It's
Mm.
just that obviously there's the risk of litigation. Anything new that has the potential for having something go wrong is avoided like a plague. It's one of those things. It's medicine. We're still using pagers in the medical system. This is how old our system is. Pagers, because the data that you get is not going through some cell phone where it could be accessed through someone who could hack the system. Like pagers is probably the safest way that you transfer information. But that's a reflection of how medicine works. It just doesn't want to take risks. And the other thing is we're very dogmatic. I think when it comes to any type of new recommendations, you first need at least X amount of RCTs, randomized controlled trials. Sometimes you need a meta-analysis, a simple systematic review that then subsequently shows that it's proven there. And then you need guidelines by, if it's AHA, American Heart Association, or ACC, you need those, and then it becomes accepted practice. So by the time there's some general evidence, by the time it gets incorporated into real practice and guidelines, it's about 10 years. So in a lot of this, what you're doing now is a lot of the stuff is just only recently made available in terms of the broad availability of tests like this at a cost that you could afford. I would say if you asked 10 years ago, it probably wouldn't have, I don't know, it's probably you could have done it, but it would have been hard to find labs that could do it. Whereas now it's just coming into the forefront. And also the supplements, all those things in terms of the rich amount that's available now, I feel like you're on the forefront. I think you're truly, obviously each person is different and each person will have different formulas, but you're finding out things like certain patterns like sulfation and methylation. The idea that sulfation actually gets consumed with exercise or that is new to me, but you clearly found that out through the study of your own system.
It's not only
Kudos to
that
you. I think
actually.
this,
It's not you can
yeah,
actually ask ChatGPT and it'll tell you that. Ask if, for example, if you ask, does
yeah,
sulfur groups get consumed by exercise? They'll tell you yes, right? And now I was able to figure it out on my own body, but
yeah,
the ChatGPT just summarizes the whole internet essentially. and it got confirmation from ChatGPT, right? That was quite interesting. Same with the
Yeah.
mental stuff, right?
Yeah. And the reason ChatGPT does that, because it's almost there's a level of deduction that ChatGPT does. Obviously, it hallucinates a decent amount,
Right.
particularly when it comes to medical stuff. And I will see things that it claims that there's a reference, and when you look, there's not an actual reference there. But what it does is it takes all the evidence that's out there in the internet and puts it together, and then it deduces things. It sort of says, all right, by logical reasoning, there's something here with sulfation, with exercise or something like that. It's not like that. It's not like there's a number of studies that were done out there. So that's, to me, that's where it's fascinating. Maybe that's where I think the ChatGPTs really come to an answer for you. But I'm finding
Yeah.
this fascinating, Joe. I would love to learn more.
Yeah.
Yeah.
You're welcome to study me. If you have any clinical trials, I'll go through any clinical trial.
No, what we do, for instance, at LabFront, what we're very much into democratizing health sciences. And this is obviously to bring to the citizens and the patients that are out there. But right now, we're targeting researchers, clinical researchers. So we have a network of researchers that are out there that are interested in incorporating wearables in sort of their study, whether it's HRV, actigraphy for sleep or activity. But if there's some kind of supplement or some kind of group out there that's interested in studying sort of the biochemical pathways that you're assessing, I could see if we could create a link, because I think this should be studied and really made public in a personalized system level way. That would be
Yeah,
great.
I would agree with you. There's certain things that I'm doing that it's clear something's happening in a certain way, but it's not studied enough. Sulfur is one of them. Methylation is another. BT clearly knew that when you exercise, you consume the sulfur groups, but it was something that I just realized through my lab test. I'm like, the only correlation, like the biggest factor for my homocysteine going up was just more exercise.
Really?
And
So exercise is
literally,
actually not good for you.
no.
Okay.
And then it also worsens my HRV, but with the supplements, and by the way, if I look at self decode, I'll just show you something quite
Yeah.
interesting. But basically, it says that based on a bunch of variants, I am poor at methylation. So I clearly have a genetic predisposition to lower methylation, and I know this based on my clients. Also, like I have very few clients, but the people who I do have, they do very frequent testing, and what I see is somebody could be exercising more than me and taking the same methylation supplements, and their homocysteine is like way lower, right? They don't have that predisposition for lower methylation. Whereas me, I've got that predisposition. And when I exercise, it just puts a very big strain on methylation. Clearly, it's not happening with other people. So I do think, and by the way, this is something that in my entire family occurs. So nobody in my family exercises a lot because basically they all start getting problems. And I think
Wow.
yeah, like my mom, everybody is just they just don't exercise a lot. They're like they start exercise, they start getting injured, they start getting a whole bunch of different kinds of issues. I'm the only one that did it and measured exactly what's going on in my blood when that happens, and then I just reversed it. So now I can exercise more than 99.9% of people, and I'm fine because I reverse these kinds of stresses on the body, mainly in terms of methylation, sulfation, mitochondrial function, neurotransmitters. So actually, another thing, methyl caused me to get anxiety. Exercise caused me to get anxious.
You mean
That's not a
active exercising?
yes.
You mean the
After like
active exercising
an
is okay.
hour after
Oh, after.
exercise, I would start getting anxious, and it's not clear why that would be. Right? Why would you get anxious
Yeah.
after exercise? It turns out that exercise consumes a lot of tryptophan, right? And also certain
So
antivitamins as
reduce
well.
serotonin.
It reduces serotonin. I'm already
Yeah.
low. I was already low on the serotonin. And basically, but then when I just increase my serotonin, I take tryptophan, I take 5-HTP, I take a bunch of herbals that increase serotonin. All of a sudden, there's absolute like I never get anxiety from exercise, right? So it just doesn't occur. There's other things that occur as well. There's other mechanisms could increase oxidative stress, which could cause
Yeah.
glutamate to go up. But essentially, if I have enough serotonin, that doesn't occur. So I feel like there was a bunch of things that made me not do well with exercise, like tryptophan going down, serotonin going down, not enough sulfur, not enough methylation, other fact maybe mitochondrial function not working optimally. all of a sudden, maybe too much inflammation, whatever it is, I got rid of all these things. Now I can exercise as much as I want, right? And my HRV is still
Yeah.
pretty good. My homocysteine went down to 8, and my all my sulfur markers are all good now. So it's now, and I'm the only one in my family now. I could exercise 20, 30 hours a week. Everybody else, if they exercise like 4 hours a week, they're starting to get injured. Their back hurts, their knee
Yeah.
hurts.
Yeah. It's amazing. This is the model of what personalized medicine should be about. Like for you, like clearly you found out exercise didn't make you feel better. That probably explained for why your HRV came down. And then you're wondering because there's so many potential mechanisms by which exercise could be detrimental for you. And then you really go through the pathways and fascinatingly, you let methylation pathways, that probably is the biggest factor. So your ability to hone down, like you maybe have an overall objective marker, maybe it's how you feel, HRV as a global marker, and then you hone down, use your biochemical tests, and then you could do the different pathways and then find out why. It's really, that should be the model for all different kinds of conditions.
I want you to talk about your company exactly and what you're doing there, how you're furthering health through your company.
Yeah, actually, so this company was a spin out from our lab. I was at Beth Israel Deaconess Medical Center. It's one of the Harvard affiliated hospital in Boston. And we had a lab called the Center for Dynamical Biomarkers. And it was a lab that focused on understanding time series. So time series is basically any type of physiological signal that you get continuously over time. So whether that's heart rate for heart rate variability, whether that's EEGs for brain signaling, et cetera. And we applied novel mechanisms, so novel mathematical approaches to that, which include nonlinear mechanisms, which at some point it'll take a full podcast to discuss about nonlinear mechanisms. But there's some very interesting mechanisms, like our body has some fractal properties, like the time series. It's not linear. It has some very complex patterns into it. So we're interested in understanding the signal among the noise in that, and we evaluated that. At some point, we decided that in the age of wearable devices, that this was going to be useful to apply some of the techniques that we had and apply it to the day-to-day physiological signals that you get from your wearables. And so we spun out LabFront, and what we are doing is we were recognizing also that there was an uncomfortable trend of having a lot of the data that you get from wearables gobbled up by big tech, Apple, Fitbit. All that data is kept and even sometimes repackaged and sold to third parties. And the participants or the citizens didn't have the capacity to actually access the raw data from the wearable devices. And so what we've decided to do is we partner with companies that were willing to make the raw data from wearables available to users so that they could use it for whatever purpose they need. In our case, our big partners are Garmin. So Garmin is by far our biggest official research partner. And we also work with MoveSense, which provides like EKG and a 9-axis IMU, so inertial measurement unit. And then we also work with Dexcom, which is continuous glucose monitoring. What we do is we work with those companies, make that data available. And our primary target right now is clinical researchers, but at some point it'll be patients. But for the time being, clinical researchers who wish to administer their study and research so that they could understand what's happening at home as opposed to having come into the laboratory. That way you can understand, like if you're studying diabetes or if you're studying depression or anything like that, you want to know, was the participants' sleep like? What was their stress level? There's all these different things. And you also want to administer surveys on a consistent basis. So you want to do it at home. So you want to see like a PHQ-9 to measure depression. So what we do is we created a platform that's mobile based, and then researchers can administer these surveys and questionnaires so that all their study participants can fill it out. And at the same time, we integrate all that information with the wearable data that we get. So that's heart rate variability, activity, stress, and then continuous glucose monitor. And then we're looking to expand to EEGs and other things as well for brain activity. So that's a summary of what LabFront does. But we're very interested in the biochemical labs part too, because I think there's a whole world out there that we haven't even touched yet. And so it'd be interesting to see if self-decode could help us out with that.
Yeah, absolutely. Definitely. That sounds really cool. All right,
Yeah.
awesome. Yeah, I it was great chatting. Do you have anything that else that you'd like to mention before we go?
No, other than it was great to meet you, Joe. I really appreciate what you're doing, and I want to actually learn the things that you're learning. So it's great.
It was great talking to you, and yeah, let's be in touch.
Yeah, let's do that. Thanks, Joe, so much for having
All
me
right,
on.
my pleasure.
All right,
Thanks.
take care.
67% of listeners aren't subscribed to the show, so please don't forget to show your support by hitting the subscribe button now. You'll not only be supporting the show, but also investing in yourself and your health journey, all while helping to keep us ad free.